G'day, I'm Semaan and welcome to the DM Academy lesson for today. I'm going to be talking to you about how to create patient management flowcharts for dental monitoring implementation throughout your office. Now, what you need to do, set some time aside, maybe a lunch break, sit down with your dental monitoring champion and maybe your manager, whoever's involved in the creation and implementation process in your office, and sit down and ask yourselves the following questions. How do I handle a slight unseat? This is for clear aligner treatment. How do I handle a noticeable unseat or something that's gone off track a little bit more in my office? And then write down the answer to that. And then go through all the other clinical things that can happen in the office when a patient's in your chair. So imagine anything happening in a clinical situation that brings a patient into your office and ask, how do I deal with that situation? When a patient rings up and says, oh, I've lost an aligner, what do you tell them? Write that down. How do you handle a broken aligner? Write that down. Think of every possible scenario and just write down the answer to that. That does two powerful things. One is it gets out for your team exactly how you think. If your team know how you think, your team know how to then answer questions on your behalf. So it creates an opportunity to get some scripting. That's in a separate DM lesson. The second powerful thing, and this is about the flowcharts, is it's going to help you create a flowchart. And we'll go through that right now. In dental monitoring, there's a term called slight unseat. In this picture here, if you look closely, you can see the edge of the aligner sitting a little bit off the edge of the teeth. That's simply called a slight unseat or a slight gap. We created in my office a flowchart, as you see here, about how to deal with slight unseats. This will be incorporated into the dental monitoring software. And behind the scenes, you'll set up little scripts and templates about how to deal with things. Your virtual clinical manager will use this and your team as a guide about how to handle patients who aren't in your office but have a slight unseat. So before the days of dental monitoring, you'd hand out a few aligners, they'd come into your office, you'd take a look, and you might see a slight unseat. What did you do? That's what you want to ask yourself. Did you ask them to stay in that aligner? Maybe chew on the chewy a little bit more? Whatever it is in the way you handled it, you want to think about how you now handle that, but they're not in your office. And it sounds a little tricky, but it's actually not. So just, once again, I always tell my team, just imagine, because they'd come to me and they'd say, oh no, we've got this notification about something. What do we do? What do we do? And they'd not panic, but they'd sort of be not sure what to do. And I'd say, just pretend that person who's on the phone or sent you a message through dental monitoring, just pretend they're in the chair right now. What would we do? And the answer to that question then becomes the answer of how to solve that problem. If it's something that requires coming into the office, then it's a matter of telling them over the phone or through the app, sending them a message and say, Mrs. Jones, that sounds like something we need to take care of in the office. Would you please call the office and make an appointment to see me immediately for 10 minutes or whatever it is. But a lot of these things, thankfully, can be managed and handled out of the office. It might be that you decide they just need to chew on that specific area on the lower incisors more with their chewy. Or it might be over the phone that you talk to them about their compliance and all the things that you would, if you're sitting in the chair and say, Mrs. Jones, how many hours are you wearing your clear aligners? Oh, I'm just wearing them probably 10 hours a day. Okay, well, the other 10 to 12 hours a day, you should be wearing them. That's where your teeth are starting to go off track and you can start having that conversation. But instead of doing it in the office and taking up your clinical time, you can have that conversation over the phone with your virtual clinical manager who has that clinical background and understanding and doesn't take up your doctor time. Okay? So that's how it works. And the flowchart is really just a way of breaking up those experiences and those things that can happen. No different to a call center. When someone calls up about something, they go through a series of questioning. Are you interested in this? Yes, then we're going to ask you now these questions. Is it this situation? No, then go to these questions. So I'll give you an example. You can see there on the top left, it says one tooth. So what that simply means is it one tooth that has a slight unseat or is it multiple teeth? In that picture I showed you moments ago, it shows multiple teeth. So we would go to the right side of the diagram that we've created in our office where it says multiple teeth. And we flow down from there, and then we sort of go, well, is it the first time that they've had a slide unseat, or is it the second time? And you can follow that down, and it just splits up which way to kind of handle that process. Now, I know it looks really messy, but and it'll be something that it'll be stressful, I promise you, because it was stressful for me, but just be patient. Never give up. Remember Winston Churchill, never give up. Sit down just with a big blank sheet of paper and a pencil or a pen and just scribble out these sort of flows and arrows and things. And it'll come together, I promise. With the right mindset, it'll come together about what to do. And this is what I came up with. So I recommend using it and then modifying and adjusting it, because you're going to treat things a little different, or maybe very different to how I handle them in my office. But it's a starting point. And then you can work with that and make it your own, create your own version of that. But at least it gives you an idea, because the people will call up, or you'll get a notification and your staff will say, well, what do we do? They can turn to this flow chart and they can sort of follow it through and know what to do, whether they call them, bring them into the office, or whether they handle something verbally over the phone. Or sometimes what we'll do is we'll take a snapshot of the area that's the unseat, draw a little arrow and email it to them or text it to them. So use technology, be creative, and I promise you'll be able to handle so much without bringing them into the office. And that frees up your schedule again, which is great. Here's just an example of a slide unseat. We handled all of this without bringing the patient into the office. We picked up on it, we notified them of that after we were notified through the dental monitoring app. And then we simply said to this person, chew on your chewy on tooth, the upper left central incisor, and a short while later, the tooth is now tracking. We're back on track. Before dental monitoring came about, we would never have known about this unless the patient was acutely aware of gaps between aligners and teeth. And trust me, they don't keep that close an eye on their teeth, but dental monitoring does. A very close eye, closer than our naked eye can do it. And so you can imagine if this person just progresses with their aligners, things can really go off track there a lot, to the point where it's unrecoverable. Worst case scenario, but depending on how many aligners you've given them, they'll come back in a number of aligners in weeks, and then now you've got a really serious problem to deal with. You're going to have to backtrack, if you're lucky, button elastic maybe, whatever, but that's avoidable with the dental monitoring process, because we're notified really quickly about any kind of slide unseat, and you can get onto those problems quickly. So I love slide unseats because we can deal with them really, really quickly and deal with most of those without bringing them into the office, which is amazing. So what happens when things go a little more off track, or as dental monitoring call it, a noticeable unseat, as you see in this diagram? Well, this happened before dental monitoring happened. This is not something dental monitoring created. This is something dental monitoring helps us handle. So let's go through that flow chart. Don't get scared. This is a lot busier, this flow chart, of course. But once again, just go through this bit by bit. So, I've split it up into my office into 3 categories. One, is it a posterior tooth? And there's a flow chart for that. Is it an anterior tooth, or is it multiple teeth? Take a note of that, and you'll see that there's different scenarios there to flow through. So if it's a posterior tooth, we give them a call on the phone. We check to see what their compliance is like. If it's good compliance, we bring them into the office and we go through the process of deciding whether we can get it back on track or not. Do we need to get some more additional aligners, or whatever it is that you'll do clinically to handle that situation. If it's poor compliance, then we get them to stay in that aligner and keep chewing and reviewing that process. If it's one anterior tooth, we have a similar process where we'll have a look to see if there's an attachment on the tooth or not. Obviously, if there's an attachment on the tooth, then we'll take the attachment off and we'll go through a process of recapturing that tooth with a button elastic technique, which I hope you're fully aware of. It's a common technique, clear aligner therapy. And with braces, you'll have different flows as well. Is it a broken wire? Is it a broken bracket? That obviously requires a visit in the office. If it's a hygiene thing, that doesn't require a visit. It requires just a phone call and a chat perhaps by your virtual clinical manager. So it's just a process of going through a typical day in our office and asking ourselves, what do we have in the chair every day in my office? I'm dealing with this situation, that situation, and it's just exhausting all those situations. Then asking ourselves what's possible in each of those scenarios, and you'll work it out. You'll say, well, if it's a broken wire, they have to come in, or if it's this situation, we can deal with it this way. And then it's just fleshing that out on a visual diagram. That's all this is. This is just what happens typically in an orthodontic office, broken down into steps, and certain steps are clinical and you might give those a certain color, and then others that are non-clinical that could be done with some good reassuring advice, could be in another color. And then your virtual clinical manager will know then how to handle that. She'll say, well, that requires an in-office visit. It's a phone call from the reception and get them in. Or that requires just a message and it requires this templated answer that we've got ready to go. So I hope that helps you understand kind of how to go about it. Once again, this might not work in your office, my exact flowchart, because I run things my own way here and you run them your own way, and my ways are not better than yours. But it's a starting point. It gives you an idea, I hope, and a big help about how to get implemented and how to handle your virtual patients. This is an example of a noticeable unseat. So it was picked up by dental monitoring. This is a dental monitoring scan picture. And after calling the patient and discovering that they had very good compliance, we decided to bring him into the office, and we did a button elastic on that lower right canine and recaptured it, polished the attachment off, of course, recaptured it, put the attachment back on, and kept going. Thank you for being patient and listening to my presentation today.